The digital divide refers to the difference in access to information and technology between socioeconomic groups, ethnic groups, and geographical regions. In the early stages of the internet, only those who had access to a personal computer were able to take advantage of this resource. The access was usually for those in higher income brackets versus lower income and minorities. College students, which included an even smaller grouping of low income and minority participants, had access too. Today, anyone can access the internet on a smartphone and look up any interest, including health-related information. With the advent of high-speed internet connections and broader bandwidth cellular networks, we seem to have closed the digital divide to a crack. There is, however, a gap in the digital world that exists for users, and it is not a small matter. The divide between those of lower socioeconomic status and those who sit slightly higher and above it is still there when we look at the illiteracy levels involved. According to Errol Sharif, people with lower education and income levels are less likely to look for and use online health information or be dissuaded by the amounts of information they may not have a context for. This does not take into account the amount of false or misleading information. Anyone who types in a question can see hundreds, if not thousands, of pages of results that seem to offer exactly what the seeker wants. This problem exists just as prevalently with health-related information as it does for what are the best tires for my car. It's a problem of health literacy and overall internet literacy that seems to have people lost in the woods of the internet landscape. According to the World Health Organization, an individual with low health literacy refers to a person who may experience challenges in managing their own health effectively, accessing health services, and understanding available health information, thus decreasing the likelihood of making an informed health decision. The need for simple to use and collaborative space on the internet, the general and super user in the healthcare domain, is essential for reducing the contamination of factual evidence versus popular theory if we are to promote health and wellness to our communities and our larger cultures. There exists no real place that someone can ask a question of a qualified professional that has not been infected by a paywall or such a multitude of advertising that it makes for a labor of mind or just plain confusing for the client. With the intrusion of social media disrupts the actual practice of medicine, we see dire consequences. Take, for example, the anti-vaccination movement. In one article, it's reported that posts about the dangers of vaccine are prevalent and easily accessible online. It's been reported that 43% of hits for vaccination and immunization on top search engines contain anti-vaccination material. This type of result is dangerous to the children who are not vaccinated and the immune deficient sections of our community. In an effort to promote the most healthy lifestyles, the Layman's Initiative was started to promote better communication and understanding of medical information. The clients of healthcare institutions need a reliable, responsible, purpose-driven, and safe place to answer the medical questions about illness, treatment, medication, and general health and wellness. We aim to serve the public interest by providing that service in an easy-to-understand digital format, available 24/7 to all clients. We never really take into account the lives of other people beyond our personal interactions with them. I would like you to watch this video. It's short, but it's powerful, and I think it drives home the point that I'm trying to make with this presentation today. In an interview with a nurse practitioner, I learned that not only has she seen the evolution of electronic health records, but her clinic, which is an ambulatory and specialty clinic treating HIV patients, she is also very concerned with the health literacy of her clients. Some of these people are professionals, and some are low income and even homeless. But regardless of their position or socioeconomic levels, they're still in danger of making mistakes and falling prey to bad information due to poor health literacy and the inability to do proper research online. For this reason, she fully endorses the idea of client education and having a place for them to go for trusted and verified information regarding their health issues. I picked these 5 articles because each one of them deals with e-literacy and e-health literacy, barriers to people finding the information they need, and the possible pitfalls and dangers to their health if they go and look through the wrong things. This is a problem that we can solve by creating a space for people to ask these questions and get a professional to answer them for them. The brochure I created was aimed at the health professional to get them to join the team and to explain to them exactly what it was we were going about. We're trying to straighten out the misinformation and the hiccups and potholes and pitfalls that exist for anyone who's not a medical professional when they just simply look at their lab reports or don't quite catch it all when their doctor tells them what the treatment plan is or how it may adversely affect them. We want them to be able to stand up, do their part, and create a relationship with patients and the community in general so that everyone has a better trust and a better understanding of what it is that we're all about and what our mission is to help them have a healthy lifestyle. The electronic health records I focused on is an open source and free software. The reason for using an open source electronic health record is that development is ongoing. It's customizable to the specific needs of the user. Having this as an option, we can update and modify as needed as our users suggest or their needs change. OpenEMR has all the features needed to complete these tasks on a daily basis. They have demographics, recording for ongoing research, which are vital to the future of our initiative. So they can point us towards the people most in need of our services. There is scheduling for video and text communication for more in-depth questions that require a conversation, not just to answer a question. A patient portal for the client and the provider to see answers and refer back to previous interactions. Management software for our business needs and to generate reports for further streamlining of our initiative. Contains multi-language support for all demographics to ensure proper communication without the language barrier. Security for patient protection and HIPAA compliance, and a vast amount of support with a large community for user and operator questions and issues. Software is free to use, and therefore the licenses are at no cost. The training required for this is the same as any other health record software, and it works on Mac, Windows, Linux, and mobile operating systems for full portability and cross-platform usability. I'm sure many of you will understand this when I say that social media can be a major part of the problem. There are things, memes, ideas, and agendas put forth through social media that are not only harmful, they're deadly. We've all seen the challenges on YouTube, TikTok, Facebook that were downright dangerous, if not just malicious, for being put out there. So, in that vein, no social media will be utilized by the Layman's Initiative. The need for social media is non-existent, as this initiative is not for social reasons or to turn a profit beyond operating costs. If the need arises, then the issue will be tackled in a form of an open meeting with the contributors and voted on for policy. As it stands, currently no one involved is to use the organization's name, likeness, URL, or authorize any statement as belonging to the initiative in any way without approval from committee or democratic decision. Complaints and concerns will be addressed on an as-needed basis and through the business model of question and answer, with representatives escalating the concern up the chain of command, all the way to legal if need be. In the area of technology, no specific piece of technology that you can hold in your hand is needed. We are going to be working with the open source software as an overlay and an addition to any electronic health record that may be used by a professional or provider. We simply need a website, so the patient portal has somewhere to direct the client so that they can set up their own unique signifier. And in looking at website creation, we took the easy to use and modify route with Squarespace. The decision was made as it has a great deal of support, and the option we chose allows for an unlimited amount of contributors. It has security, customization, it's mobile optimized for those on the go, and the marketing to get us to providers and allow for the maximization of exposure that will let us get the word out. The cost is about $18 a month for the business plan. The site has templates and drag and drop features for the contributors, so training is encompassed in the company's website and can be case specific if the contributor wants to add a blog or an article for the public or others in the organization. The realm of federal regulations. And in accordance with all federal regulations concerning HIPAA, the clients are assured safety and security using our services, as they are absolutely anonymous. The system will allow the client to specify a username and can enter an email if wanted for further contact. All records will be secure and will not be available to the providers of answers or research materials. This is simply a question and answer service. After an analysis is done on frequently asked questions, there will be a database for the client to look through without the need to create a unique account or signifier. The HITECH Act implies that federal regulators can oversee and inspect the systems at will for safety and security concerning client information and confidentiality. Once again, this is not too concerning in that the client is anonymous and need not worry about personal information being disseminated, as no such information will be collected. In that the information, such as any volunteered information, demographics, comments, or suggestions, will be collected for quality control and streamlining. It will be secure behind pre-existing architecture and not be available as anything other than statistical data. This will extend to drug and alcohol abuse questions. We're moving forward with the intention of providing a public service and giving out information to clarify subjects that people have concerns about, not the judgment or reporting of illegal or illicit drug use. In that vein, we will be more than obliging with the information concerning hotlines for counseling, drug abuse, and services available, and connect anyone who asks to the appropriate providers, no questions asked. To train our representatives, I found an activity that pairs students to simulate dealing with a client that has low language and literacy skills, titled In Another's Shoes. This relates to the initiative in that it will provide a substantive practice for speaking or writing to an individual that does not have the knowledge or background in the medical field. Sensitivities to others' education level and even their culture is paramount for the continued trust and respect needed to promote a healthy lifestyle in the community. We need to be able to communicate properly and without seeming to talk down to anyone, to allow them to get the most out of what we can offer. I will admit, I'm not a money person. I'm not great with numbers. But I believe that I have a working model of at least a loose budget with an administrative budget concerning a team leader, 2 IT team leaders, 4 database administrators, sitting at around $440,000. The cost for the software license is $0. The website would be $216 for a year, a $5,000 a year development fee with an operational total of around $60,216. And outside cost budget, I looked into a server backup at around $300 a year, marketing, a budget of $10,000 a year, and a tentative legal budget at $50,000 a year because, well, we have to protect our backsides, don't we? The budget request in total is $720,516. The grant proposal, also not my forte. But for this one, I picked the data science research for personal health libraries. The reason I picked this is it fit right in line with what we were wanting to do. It was trying to help clients build medical libraries for themselves so that they have something to go back and refer to when they have questions or when they are looking into health issues they're dealing with. I thought this was appropriate, and it even has a clinical trial option so that we could possibly just put this into use without actually having everything set up. In conclusion, my takeaway is I've learned that the field of informatics is more than just data on a screen for someone to analyze. It's a thread that runs through the entire system. It has been a boon to all who reap its benefits on a daily basis. From the streamlining of paperwork, transfer of medical information of both the provider and the client, the cross-checking of drugs and possible interactions, the ability of clients to review their own lab results, all of these things were not so easy or available just 20 years ago in such a unified and accessible way. The field of informatics has changed the way healthcare is administered and administrated from the top to the bottom, with an eye on efficiency and accountability. We never stop to consider the people behind the scenes until something goes wrong. It's more obvious to me that people who are working in this field every day are just as responsible for the outcome of a client's healthcare as the people who attend to them in person. This class has taught me some responsibility too. Time management is not my forte, but I'm learning to do it. Balancing family and responsibilities included in my academic career, that's no easy feat. However, patience and perseverance, I'm making it possible.